Hi everyone, thanks for coming back to my channel. I just wanted to start out by saying the usual, that I'm not a medical professional, that I just am one breast cancer survivor wanting to give tips to other breast cancer survivors to make their journey a little bit easier. I will be showing you some products and some links that I'll be providing in the description box. I just wanted to say that I'm not affiliated with any of these companies or with these products. It's just products that I found helpful when I was going through my own journey. So in doing that, I will start the episode. In today's episode, I will talk about my chemo treatments that I received and how things went for me, including the side effects that I had. And I will be sharing tips that I learned along the way, and we'll be showing you items that I bought to help make me more comfortable as I was going through my treatments. And I hope that you find some, if not all of these things, helpful in some way, and that they help you get through your treatments with a little less discomfort as well. So this was a scary time, of course. I had never had chemo before. It wasn't really an option for me not to have it. I was told that I would have to have it either way and that I would need to start with it. So I didn't really have much of a choice. So of course I was scared. I didn't know what to expect. I was nervous and anxious about getting started on the treatments. The first day I was super anxious. I was crying. I went into the bathroom to cry while I was waiting in the waiting room. I didn't want other people to see me cry, but it was a very stressful time, and I was there by myself because we were going through this during the one wave of COVID, so you weren't allowed to bring anybody with you, so I had to go through this myself. So that just made things a lot worse for me. I also didn't know how I would feel. Would I have the side effects that they told me that I might have, and would I be strong enough to get through the treatments? Those are the questions that I had that were adding to my anxiety, especially the first day that I went. The drugs that I received during my 8 rounds of treatment, so I had treatments every 2 weeks for 8 treatments. So for the first 4 rounds, I had doxorubicin, also called adriamycin, and cyclophosphamide. And then the next 4 rounds were with paclitaxel or Taxol. So these drugs were specific to my type of cancer. You might receive something different. So I would ask your doctor about specifically which drugs they will be giving you for your chemo treatments if you are having them, and what symptoms, side effects you can expect from the drugs that you're going to be receiving. And then you can also do some research on your own to educate yourself a bit more on the type of treatments that you'll be having, how they work, what side effects you're going to get. Sometimes the doctors don't always tell you all of the side effects because they don't always happen to everyone. So I think just find out which medications you're going to be receiving if you're going to be having chemo, and then you can educate yourself on what to expect. The side effects that I was told I would potentially have from the medications that I was receiving with my chemo were hair loss, nail damage or loss, really dry skin, nausea, vomiting, sores on the roof of my mouth, fatigue, and weight loss. All of which, of course, terrified me, especially the hair loss. I feel like as women, we have a hard time with the hair loss thing because it's part of our identity. I'm sure for the male patients it's the same. So for me to think about hair loss, it was pretty scary. They also told me that I would need to take time off work, which for me, I wouldn't be able to do as my finances did not allow for that. So I actually had to work through my chemo treatments. I got lucky that I was able to work from home for a few months so that I was able to lay down during the day when I needed to. And my manager was really good about understanding that I would be having times where I couldn't sit up and do the work. As long as it got done, she didn't care what time of day it was. So that actually kind of worked out for me because, as I said, I was working right during a wave of COVID. So if I had had to take time off work, it would have been very difficult for me. At that time, I could have gotten employment insurance, something we have here in Canada, but at that point it was only 15 weeks, and that's not enough time when you're going through chemo and then you're going to have surgery maybe later on and then potentially radiation. 15 weeks isn't enough. So I'll be honest, finances didn't allow, so I did not take time off. I just worked from home and tried to save the weeks off that I had for employment insurance to use that during the time when I would be having my surgery. So you may need to do the same thing. It just depends on what your financial situation is. So the side effects that I did actually have, I did have the hair loss. The hair on my head was actually lost first, and then later on I lost my eyebrows and eyelashes, but that didn't actually happen until my treatments were done. The hair loss happened sort of, I think after my second treatment. I noticed clumps of hair starting to come out, so that was pretty upsetting. And my self-esteem took a hit, and I didn't, I lost some of my confidence because I didn't have hair. As I noticed that my hair was starting to fall out, I decided to shave my head. So I shaved it almost all the way down to the scalp, which I found out was a bit of a mistake, at least for me. My hairs then had a harder time falling out because they were so short. So, and my scalp was very sensitive. It was actually causing pain to have the hairs in the follicles. So because I had cut it so short, I wasn't able to just like comb it or pull it out. So I had to take a soft cloth and I had to kind of gently go over my scalp every day until all the hairs came out. And then at that point, I was completely bald. So if your hair starts falling out and you're comfortable leaving it until it just kind of falls out on its own, then I would definitely advise that. If you can't deal with it that way and you want to shave your head, I just wouldn't go right to the scalp because you could end up with the same problem that I had. So that's just a little piece of advice that I would give. And I know for the hair loss, if it's if it's a potential side effect for the drugs that you may be receiving, you can also try a cold cap. I've heard of these. They're very expensive to start with. I've also heard that they're very, very uncomfortable to wear. And basically what it does is it keeps your head really cold so that it protects the follicles. Now, it doesn't always work. It may not save all your hair, but if that's something you are interested in, that's also an option for you as well. You can also use scarves. I personally didn't use them because I just didn't like the way they looked on me. So I actually bought these satin lined hats. They're actually like sleep hats, I guess. So I wore those. They were really comfortable on my sensitive scalp and they helped keep my head warm. I had to wear them around the house even because without hair your head gets pretty darn cold and you don't even realize how warm your hair keeps you. So I wore them around the house, but you could use a scarf or a hat, whichever you're more comfortable with. You also can try a wig, which I did not do. I just found that it was too uncomfortable, and it was also very hot, and I was already kind of going through some menopausal symptoms like hot flashes, so wearing a wig just wasn't really an option for me, and I just couldn't find one that I thought looked good on me. So I just opted to wear hats all the time, but you can choose any of those options or a combination, whichever makes you feel more comfortable. Another side effect I had was the nausea and vomiting, especially during and right after my treatments. I had sores on the roof of my mouth. So for the sores on the roof of my mouth during treatment, the nurses at the chemo suite I went to actually told me to suck on ice chips as they were administering the medication, because it helps kind of keep the blood flow away from that area so that you're not getting those sores. It actually worked quite well for me. So every other time when I went, I would just suck on them. They would give me the ice chips. I would suck on them for a little bit before the treatment started and during the treatment, and it helped. Because the first time I had the treatment and I didn't do that, I had a really big sore on the top of my mouth, and couldn't really eat much, and you're already feeling sick and not hungry, and it was very difficult to eat because I had this big sore. So that's just a tip I picked up that I'm sharing with you as well. May not work for the medications that you're using, but if you're on some of the same medications that I'm on, then it may work for you. Another side effect they told me about was weight loss. I did have that. I lost about 10 to 15 pounds because it was really hard to eat. Just like I said, because I felt so sick and I had sores in my mouth. So it was very difficult to eat. So what I did was I had Ensure, Boost, whichever product you know about. I kept those in the house because they were easy to take in. It's just liquid, but it has all your nutrients, and you just keep them in the fridge. It's super easy. You don't have to prepare anything. You just take it out and you drink it. So I kept those around to kind of help minimize the weight loss, because otherwise I probably would have lost more. They told me about fatigue. I did have fatigue. I was body tired as well as mentally tired, more than I had ever been at any other time in my life. I can't stress this enough too. If you're able to take naps during the day, or go to bed early, then I would say yes, do that, because I just found I was so, I don't know, I'd call it bone tired. It just felt like it went right to the core of my body, like just so tired. So I would lay down during the day. I would try to go to bed earlier at night. If you're able to do that, then definitely do it, because your body is gonna need the energy to get you through your treatment. So whenever it's possible, just go to bed and just take any help that is offered to you. Another of the side effects they told me I would have was either discoloration of the nails or nail loss. So I actually did have discoloration of my nails. They became almost like a blackish color underneath the nail. It was a little bit scary. So I used lotion on my hands, especially around the cuticles, every day. And to protect my hands, I put on rubber gloves while I was washing the dishes or using household cleaners, anything like that, just to help keep the nail health as good as possible so that they wouldn't fall off. They did not fall off, thankfully. I just had some pretty discolored nails. So that's something to watch out for. If you're told that that's a side effect for you, that's a tip I have. Just make sure you're taking care of your cuticles and that you're also wearing rubber gloves. If you bite your nails or pick your nails or anything like that, definitely do your best not to do that, because that's just probably going to make it worse. So I did whatever I could to protect my hands so that my nails would not fall off. So that's another side effect that I had, just the discoloration. Thankfully, they did not fall off. One symptom that I did have that I wasn't really told about was brain fog, or chemo brain as they call it. My brain felt foggy all the time. I had trouble finding words that I would normally know, and I had a lot of memory issues. I mostly kept these issues to myself because I didn't think there was much that they could do. I think I mentioned it maybe once to my doctor, and he didn't really say too much about it. So I, like I said, just tried to deal with it the best way that I could, and I would just, struggle through sentences with people. It was hard to have conversations because I would forget like words that I've known my entire life. I even forgot how to tie my shoes. So it was pretty bad for me. They didn't really go over that with me. But I did find out later from my oncologist, who's the doctor that makes the plan for the chemotherapy, that he could have sent me to a neuropsychologist and even an occupational therapist who could have helped me figure out how to cope with and live with the cognitive changes that I was experiencing. There are also workshops potentially that you could attend. I know there was a hospital in my area that was offering one. I'll probably talk about that a little bit more in another video, and if I'm able to find a link to that for anyone local, I can certainly post that in that video as well. The other tips I found helpful were to take my anti-nausea meds 1 hour before my treatment. That wasn't something the doctors told me to do, but I just found that it helped quite a lot with my nausea during and after my treatment. Another thing that helped with the nausea was sucking on hard candies. So I had peppermints, and I also had ginger candies because they did also help with the nausea. So I'm going to post a link down in the description box of the candies that I'm talking about, just to give you an idea of where you can go. I got mine on Amazon. It's also helpful to bring something aromatherapy. So I bought you can buy these little bracelets or necklaces. There's also little sniffer containers that have the little wick in the middle, and you can put whatever scent you want on those. It kind of helps. Peppermint I found was helpful to kind of sniff that as I was receiving the medications, because there was also a taste slash smell. So bringing something like that is also helpful. I'm gonna link anything in the description box that I'm talking about here that I have links to, so you can check those out for yourself. I would also bring what I would call a chemo bag. So I actually have started making these. So I kind of have one partially made up that I can show you today. So it's just basically you can bring a tote bag or something bigger if you like, depending on what you're bringing with you. So this one I made myself. I customized them with inspirational messages on the front, and then I filled them with items that you would find helpful to bring to chemo with you. So any medications that you need to bring with you, the doctors will instruct you on that. So you would want to have those in your kit. You would also probably want to bring entertainment items. So a tablet, cell phone, earphones, that sort of thing. Those are the items that I brought. I also brought crossword puzzle books because I enjoy doing those. So that's also something you could bring. You would want to bring, this is a water bottle, so you would want to bring this filled with whatever you want. The hospital does have water, but it's nice to bring your own. And again, I do make these customized to go into the chemo kits that I make. So water bottle is good. You may want to bring tea or coffee with you, and that's fine too. I also would normally wear my hat, so this is just an example. So I bought a black one and a gray one, and I'm gonna have that link down in the description box. But as you can see, this is inside out. This is the satin lining, which felt really nice against my sensitive scalp. So this is just they call a sleep cap, but it's something that I wore all throughout, and I actually still wear them now in the winter time because they keep your hair nice and smooth and they keep your head warm. So that's something else that I would bring. I would bring skincare products. So this is a Vaseline lip balm. Again, no affiliation to any of these products or companies. I would also bring hand cream. This is one of my favorites, actually. I buy it at Walmart, so it was like $4 at the time. I'm sure it's more now, but I really enjoy this one. It's very soft, and they have an unscented one if you don't want a scented one. Another thing that you would bring in here, as I said, was maybe one of those aromatherapy things. So it just looks like this. They sell, I think, Vicks vapor rub ones like this, but basically you open it up. Inside there's a little wick. I can't get it open. Anyways, inside here there's a little white cotton wick, and you fill it with whatever scent. So mine is peppermint. So then you just take the lid off and you would just sniff it, and that would help kind of with the nausea, maybe the smells in the hospital. So that's something handy to have in your kit as well. Any comfy items? So I brought like a little pillow like this. You could also bring one of those travel pillows that goes around your neck. Hospitals have pillows, but I don't know if you've ever been in the hospital. Their pillows are not great, but it's also for comfort to have your own little pillow and your own little blanket. So I brought this little fleece blanket with me because it does get cold in the hospital. Again, they do have blankets, but it's nice to have your own little comfort items with you when you go for your treatments, just to make you feel a little more comfortable. Also, any snacks that you'd want to bring, or if you're going to be at the hospital for a longer period of time. So I know for me, my first rounds of treatment were short. I think they were about an hour. So I would bring a snack and some water. But my other treatments were 5 hours, and I would bring lunch with me because I would be there for a longer period of time. So it's definitely good to bring any snacks or food that you may want to eat later on. So I would also put those in your kit, and then any candies or anything else that you decide that you want to bring with you, whatever makes you feel more comfortable. You just want to make sure that you're as comfortable as possible while you're there getting your treatments. And I also just wanted to remind you that in this period of time, self-care is going to be really important as well. So it doesn't take a lot. You just doing something for yourself can go a long way. So, if you like having a cup of tea, have a nice cup of tea. You could sit outside and just, feel the sunshine on your face. Even if you're just too tired to do anything else, you could just sit out and enjoy the day. You can try some relaxation techniques if that's something that you find helpful, or even have a nice bubble bath if you like to do that. I know I do, so I was having some more baths just to help me feel a little bit more soothed and relaxed. Whatever makes you feel good. So those are just a few examples, but whatever you enjoy doing that makes you feel good, definitely try to do some of those things. It'll go a long way to help you feel maybe a little less uncomfortable during this time. So anyway, I'm gonna end the episode on this note because I know this was a long one. I do hope that some or all of these tips were helpful to you. As I've said before, everyone's treatments can be different, so some of these tips or all of these tips might not be relevant to you. But even if only some of the tips can help make you feel more comfortable during treatments, then I'm glad that I could help out by providing these tips to you. If any of you have tips that you'd like to share on what was helpful for you during your treatments and you're comfortable posting those, please post those down in the comments section and I will share those with all of you at the start of the next episode. As always, I just wanted to say thank you for watching today, and if you found this episode helpful or learned something new, please hit that like button. And don't forget to subscribe to my channel by hitting that pink subscribe button down on the bottom so that you never miss a new video. I hope to see you back next time when I will be talking about my surgeries and recovery. And I will, of course, be sharing some definitely must-have items that will lessen your discomfort during this time. Stay resilient, my fellow warriors. You can get through this. See you next time.